Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Valley Health Minutes. Did you know that 600,000 hysterectomies are performed every year in the United States? It's one of the top 10 surgeries. And a lot of women may wonder, is that what I need to make me feel better? So we're talking to gynecologist, obstetrician, Dr. Kuhl about that today. So we're so glad you're here. This is a big stressor for a lot of women to wonder is this now the time I need to consider a hysterectomy? What are things we need to think about?
It just really depends on how a woman is feeling and what their symptoms might be. I mean, most women get through their cycles or menopause or other types of GYN changes without needing hysterectomy, but certainly if someone comes to see me with irregular bleeding or pain or other types of abdominal or pelvic symptoms, it's certainly something that can be part of the discussion to include hysterectomy as an option for a lot of those patients.
So what are some of the risks and what are some of the benefits of having a hysterectomy?
So for women who have pelvic symptoms or other types of symptoms that are not responding to conservative treatments or medication therapy or management, to have the conversation about a hysterectomy would be an option. When we look at risks for hysterectomy, if we've gone through all of the work leading up to the decision that we're making to do a hysterectomy, certainly surgical risks that are across the board, risk of infection, risk of bleeding, risk of other injury in the abdomen or surrounding organs could certainly be a problem, but we try to discuss this as thoroughly as possible. And fortunately, with the types of hysterectomies we're doing today, these risks are across the board lower than what they have been in the past with other types of surgeries or other types of hysterectomies.
And things have changed so much. Everything is robotic?
Not everything, but a lot of the surgeries that we do are robotic. If the candidate is the right person, I mean, certainly we still have reasons that we do other types of hysterectomy, and vaginal hysterectomy and abdominal hysterectomy are still performed under some circumstances. In terms of benefits of doing specifically robotic type surgeries, it does seem that complication rate, risk of blood loss, risk of injury, and then generally return to work and normal activities all seems to have improved with robotic surgery if patients are candidates and able to undergo robotic procedures.
So, but let's talk about, so there's robotic surgery, there's other types of surgeries. How long and what really does that surgery look like? How long is the time in surgery?
It really depends on the specific patient and other factors, but in general, we can typically do a robotic procedure, a fairly straightforward hysterectomy in less than 2 hours. And most often these patients are able to go home same day if they're meeting the criteria and safe. We feel that it is safe enough to let them be discharged home the same day.
How about recovery time? You know, you said it shortens it and the patient experience is usually better for robotic surgery. But in general for hysterectomies, what kind of recovery time are you looking at? Everyone wants to get back to their normal life as soon as possible.
Sure. The key point that I make to patients with robotic surgery is even though they only have small incisions, it's still a major procedure, and so we still need to exercise caution with how their recovery is in terms of doing strenuous activity or very physically demanding activity. I really still advise patients to take a good 6 to 8 weeks before really doing very physically demanding activity, even with a robotic procedure. But in terms of returning to work, returning to a more sedentary job, often they're able to go back to that type of normal activity within a couple of days to a week or two after their procedure if they're doing well.
Okay, and after a hysterectomy, are you always put on a hormonal therapy or is that just one option?
Not necessarily. There has been some good data, especially recently updated, that if a woman can keep her ovaries up to the age of 65 years old, based on risk, if we take the ovaries at a younger age, then the preference is to leave ovaries if they do look good or there is no other reason to remove them. The ovaries are the hormone producing organs of women primarily, and so there is great benefit in leaving the ovaries or retaining them with a hysterectomy if that is possible.
A lot of great information, a lot of women considering this option, so we sure appreciate you kind of breaking it down for us.
Great.
Dr. Kuhl, thanks so much.
Thank you.
Thanks for being here for Valley Health Minutes. I'll see you next Monday.